Today is an exciting day for us for a lot of reasons, and we are here to, in many respects, to tell a story of how we got to this bioactive world. And I really want to start this whole presentation with the idea and the fact that nature's given us a beautiful, functioning design for our teeth. From the development of the teeth, which start about 14 weeks as in uterine, this tooth is developing into not a non-living substance, but a living substance. So how do we treat a living substance versus a non-living substance? And why is all of this bioactive technology important for dentistry and for our patients? Well, bioactivity basically means we're changing mindsets. We're moving from a passive mindset to an active mindset. That means that the materials that we've been developing as manufacturers over the last 60, 80, 100 years have all been passive in the oral environment. And the idea was if they were passive, they would be safe. But by thinking like that, we missed opportunities to actually work with the environment, especially with saliva. And what is saliva? Saliva is supersaturated calcium and phosphate. What is a tooth made of? Calcium and phosphate. And so today I want to cover what is bioactivity. What are our current restorative materials doing for us? What are the results of those materials? What can we expect from bioactive restorations? And what are the patient and the economic benefits of us thinking more bioactively versus passively? And can we participate in this environment and complement nature rather than fight it? I love this quote by G.V. Black. To me, he was a Renaissance man, but he was also kind of a prophet in a way that if he saw what was going on today, he would say to us, we have, in essence, lived out this quote that he's saying that the dentists will just be mechanics if they start looking away from what caused disease, what caused failure, what causes the breakdown of these teeth. And so I look to him for inspiration. I also look to nature. And what you're looking at right there is man's attempt at repairing nature. And not to be too funny, but I was walking in a botanical gardens with my wife and I took this picture and I'm sitting there thinking to myself, well, that's a leaky class 2 composite. Because that's how I think. I've been in dental materials for over 40 years, and this is how I go to Roman ruins and see the same thing. But we have to start thinking naturally, instead of trying to put passive materials that do nothing into the tooth, just basically so that they have some function. One of the things we don't like to talk about in our industry is failure. We don't like to talk about the reality of what failure is. And the NIDCR report from 2009 to 2011 says that basically composites are lasting 5.7 years on an average. These numbers are ringing true everywhere in the world that I go. Replacement of the defective restorations are costing the American public in 2011 dollars, $5 billion annually. And so that's just in the US alone. And the problem is every time you replace a composite, the preps get bigger and deeper. So how many class 2s can you do before you're into other things? And so patients and governments actually can benefit from bioactive materials. I just returned from New Zealand speaking with the dental health boards over there where dentistry is applied for 0 to 18-year-olds. And they're actively switching to bioactive materials right now because they know the benefits. They've seen the benefits. 90 million replacement restorations per year in the United States. In other words, redo dentistry. We're replacing composites at a very high rate. 70% of all restorations in dentistry are replacements for failed restorations. Microleakage is the primary cause of failure. Now, I'm not talking about composites. Composites chip and crack. Microleakage is as a result of not having a seal. We think we have a seal when we have a bond, but we don't. And the bonding agents are breaking down. A good friend and a man I'm not afraid to quote is Nels Waltzen. very famous dentist here in the United States, was with a large glass ionomer manufacturer for many years, and he taught me one thing, is that composites fail from the inside out and glass ionomers fail from the outside in. Which one would you rather have? Because when a glass ionomer fails, there's nothing wrong with the tooth structure. And so we need to think differently. Can we do better dentistry today? And I want to share this video from the University of Oregon.
In the near future, dental fillings may contain a form of bioactive glass. Such glass could improve the longevity of fillings, important in a country where more than 122 million composite dental restorations are performed each year. Most fillings fail, succumbing to what's known as secondary tooth decay. Jamie Kruzik, a professor and expert in advanced structural and biomaterials at Oregon State University, explains, new tooth decay often begins at the interface of a filling and the tooth. The tooth is literally being eroded and demineralized at the interface. Fillings made of bioactive glass, however, could have their lifespans extended beyond the current 6-year average. Kruzik notes, this type of glass is only beginning to see use in dentistry, and our research shows it may be very promising for tooth fillings. The bacteria in the mouth that help cause cavities don't seem to like this type of glass, and are less likely to colonize on fillings that incorporate it. As for the glass being bioactive, the body notices it's there and reacts with it, opposed to inert biomedical products. Such a reaction may even help replace minerals once lost to tooth decay.
So see, again, you're seeing the definition of moving from passive to active, because bioactive materials are active in the oral environment. They love to work with the tooth structure. They love to work with the surrounding dentition. So the most accepted definition of bioactivity comes from Dr. Larry Hinch from 1969. He says that a bioactive material is one that elicits a specific biologic response at the interface of the material, which results in the formation of a bond between the tissues and the material. Elicits a response. In other words, when these materials go into the tooth, it stimulates the tooth to do what it does naturally, heal itself. In other words, start to build hydroxyapatite. And that's what bioactivity is all about. It stimulates activity from what's already there. And so it's also a definition has been expanded by Dr. Stephen Jeffries. And he says a bioactive material is one that forms a surface layer of apatite, material in the presence of saliva or a saliva-like solution. So since these materials are going inside the tooth, the material can actually respond to and with the dental fluids. The saliva that's surrounding these restorations are also available for charging and recharging, just like what happens naturally with tooth structure. It's all in the design of the materials. And so we have to remember, in this case, saliva is our friend. Bioactive ionic response is when these ions come from these bioactive products, they respond with or are attracted to the ions that are missing from the tooth. In other words, when the dentist is cutting preparations and or if they're doing any acidic treatment, they're creating somewhat some kind of demineralization. In that, the materials that we're putting into the tooth are reacting with those, and they're creating mineralized structures. They're actually bonding, but they're also, more importantly, sealing the tooth and protecting it from bacterial invasion. So these bonds are good, but the seal is what we're really after. That's how we're going to extend the lifetime of dental materials. So the bioactive mineral response is when these minerals come in contact with the dentin, they're actually attracted to the peritubual openings of the tooth because that's where most of the mineral substance is. And so as they collect and attach in these areas, they not only attach to the surface of the dentin, but they're also available to penetrate into the tubules and form crystals to actually help desensitize and help create more of a seal for the tooth. And again, to seal that tooth is the most important thing that we're looking at. There's also a bioactive function that we're looking at. Some people call it biomimetics. And in this case, the bioactive material that we're referring to has rubberized resins that actually closely mimic the function of a tooth. Again, that tooth is alive. It's not made of steel. It's actually functioning in force. And as it's functioning, up to this point, we're putting materials in there that actually function with the tooth harmoniously. Up to this point, we've been putting in materials that don't. We've been putting in materials that have are rock hard, and in the meantime, the tooth is trying to flex all around it, and so now the bonds are stressed, leakage is incurred, and so on. And we're trying to effectively function, if you will, micromechanically with the tooth in the biting forces and so on. There's a unique property that comes with these rubberized resins in that they disallow the strong formation of biofilm. This will be shown in studies coming out in a few weeks at the IADR meeting, that these rubberized resins and these bioactive materials basically have the same attachment rate as bioglass. This is very unique. Also, the rubberization, as you can see, is allowing the tooth to flex and again, be natural in its movement. And that's what we're really looking forward to. There's no argument, there's no fight going on between the restorative material and the tooth structure. So the other thing that we never look at is how do we compare to nature versus other products? And this is one of the most aggravating things for me personally, is when I go to lectures and I see products compared to products compared to products, and I never see products compared to what was there in the beginning. And so we have to have a mindset change. We need to think in terms of micromechanics and in terms of how we function ionically with the tooth structure. And as you can see here, tooth structure versus bioactive restoratives versus composites versus glass ionomers and RMGIs. How much commonality do they have with tooth structure? So bioactivity seals the margins. This is exactly what the issue, why restorative materials are failing today, because we have too much microleakage, not just in the gingival margins, but in other areas as well. And so although biofilm is present on these bioactive materials, it seals out. It's been sealed out by these restorative materials. It cannot get in because there's a constant regeneration, if you will, or remineralization of calcium and phosphate that's mating with the tooth, forming that seal continuously. And that's what again, these materials are active, they're not passive. So I was thinking about this the other day. Is bioactivity a Chronos or a Kairos moment? If you don't remember those terms in Greek, Chronos is quantitative, measures seconds, minutes, hours. You can think of Father Time, you can think of history. And that's the way we think nowadays in this industry. We think about saving time. How fast can we cure something? How fast? And we look at these things from a historical perspective. But those are passive. If you think Kairos, now you're thinking qualitative. The right moment, the opportunity, the supreme moment, if you will, to take that data that we have about time and failure and how long it takes to do this and that, and we can seize the moment and we can be active, like the bioactive materials. And I'm challenging not just the people in this room, but anybody that ever watches this video, the industry. We need to think differently. So dental opinion leaders agree. This is just a few opinion leaders. We have many in the industry trying to educate about bioactivity. But in the 4 years that we've seen our bioactive materials in the market, that education has not shifted the mindset of many dentists in this country. Around the world, it's different. The rest of the world seems to understand the importance of bioactivity. In this country, it seems to be more about bonding. And so bioactive, this is Dr. Salvatore Soro. He's a world-renowned biomineralist. This is a very complicated response to why is bioactivity important, but the response is perfect. In other words, we're putting materials into the tooth that help the tooth remineralize itself. We're stimulating something. You know, so many times, and especially as manufacturers, we want to look at the product as the answer, when really what nature gave us is the answer. And we need to work with nature. We need to have materials going into these teeth that actually help nature do what it does best. And so what he's saying here is these, and what I want to say is these voices are not enough. That's why we're doing this media conference. So more than 3 million bioactive composites have been placed over 4 years. This is an example of restoration done by Dr. John Kamisi in 2012 and where it sits now here in January of 2017. There's no microleakage. The wear is excellent. This is what we're hearing continually from around the world now. We're estimating that bioactive materials will last longer than conventional composites because of the seal. And so preparations can also be more conservative, so you're not removing as much tooth structure. You're saving people's teeth as well. And I know that's what dentists want to do. So dentists, distributors, and patients seem to all agree that double-digit growth has occurred since the launch of the bioactive materials that we sell. We're not saying that with pride. We're saying that this is only scratching the surface. These materials save treatment time and also additional materials once the learning curve comes up on how to use these materials. Actually, the materials are so simple it actually confounds the complex. And so bioactive composite has become the dominant portion, or the spend, if you will, in dental practices all around the world. In many dental practices, because they know the advantages. There's a lack of sensitivity, no chipping, excellent wear and aesthetics was reported by patients and dentists at a 1-year recall that was done by Dental Advisor. And the 2-year recall is going to show similar results very soon. Activa's bioactive properties provided a seal at the margin and protected the restoration from microleakage and secondary caries. As a result, the life of the tooth is extended and the patient is extremely happy. Dr. Robert Lowe. So I want to ask simply this: why did we do this? This is a challenge for the greater good. This is not about market share. This is about doing the right thing. And I'm challenging manufacturers I've been doing for 4 years. I'm challenging key opinion leaders. I'm challenging anybody doing education to start thinking about how we save teeth and we get out of this syndrome that we have with 5.7 years. So why did we do this press conference? Again, is just to move the message beyond this room, move the message beyond the current educators, because we need to. We need more enlightenment. And so why is PULPDENT, you haven't heard us say anything, you haven't heard me mention PULPDENT up to this point. Why was it us? Well, we're a family-owned and operated company. We work outside the box. We're a research and development company. We don't think about market share, we just think about doing the right thing for people globally. A lot of these products were developed originally for underserved populations. What we found out was they're a lot better than what's currently available to most dentists. So how do we change this paradigm? And so where are other companies in this process? I'm asked this all the time. The most common question is, why PULPDENT? We're not the big companies. Well, that's probably our advantage. Because we're not playing to the stock market, we're not playing to market shares or anything like that. We just do what we like to do, help people, because quite honestly, we care. So I'm challenging other manufacturers as well. We know the research is out there and the benefits of all these materials. You see researchers all over the world combining bioglass with resins, but you'd never see anything coming to market. Why? And so we all benefit when we do the right thing, and we need more of that right now in this industry. We need more of thinking outside the box, how we can make a difference, not just for our bottom lines. That should be the last thing. How can we make a difference in everyone's lives? And teeth are important. We're learning more and more about the oral environment and how important it is, and diagnosis and treatment. The restorative materials are no different. Restorative materials play a key role in everyone's health. So it's not just about aesthetics anymore. It's about functionality and long-term outcomes. And that's what we're trying to look for. So that's why we're here today. PULPDENT is committed to these long-term outcomes. PULPDENT, what you see today in this slide and what's in the back of the room that you're welcome to look at and speak to our staff, is only the beginning. There are 2 more generations of bioactive materials in the loop. And you're going to see them coming out over the next 3, 4, 5, 6 years, because PULPDENT is committed to remaining a family-owned and operated company for the benefit of all.